10. Visible warning signs of diabetes. You shouldn't ignore diabetes is often described as a silent disease, not because it lacks symptoms, but because many of its signs are subtle or easily mistaken for everyday issues. While it's true that a blood test is the most reliable way to diagnose diabetes, your body may be showing visual cues long before lab results confirm anything. In fact, a surprising number of diabetes symptoms can be seen with your own eyes, if you know what to look for. Below are 10 visual clues that could indicate blood sugar imbalances. Learning to recognize them might just save you from years of complications. 1. Going to the bathroom. More than usual, especially at night. If you find yourself waking up several times each night just to urinate, this could be a red flag. When blood sugar levels are high, the kidneys try to flush out the excess glucose by producing more urine. This process draws water from your body, causing dehydration and triggering thirst, starting a vicious cycle of drinking more and urinating more. 2. Unusual skin darkening in certain areas. Take a look at the skin on the back of your neck, in your armpits, or around your groin. Do you notice dark velvety patches that weren't there before? This condition, known as acanthosis nigricans, is often linked to insulin resistance, the same hormonal issue that underlies type 2 diabetes. It's caused by high levels of insulin stimulating the growth of skin cells and pigment, especially in places that experience frequent friction. 3. Skin tags in folds and creases. Small, soft growths of skin called skin tags are often harmless, but having multiple in areas like the neck or underarms may point to problems with blood sugar regulation. Their presence is sometimes seen in people who are overweight or have insulin resistance. 4. Recurring infections that won't go away. High glucose levels create an ideal environment for germs to grow. This includes bacteria and fungi, which thrive when blood sugar is elevated. People with undiagnosed diabetes might notice frequent yeast infections, fungal rashes, especially in skin folds, or slow-healing cuts and wounds. Infections of the urinary tract are also more common in diabetics due to the sugar content in the urine, which acts like a buffet for bacteria. 5. Hands that won't move the way they used to. Some people with diabetes develop limited joint mobility in their hands. One simple test is the prayer sign, placing your palms together. If you can't press them flat or your fingers stay bent, it could be a sign of a condition known as diabetic stiff hand syndrome. This occurs when excess sugar in the bloodstream binds to proteins in tendons and skin, causing them to become thick and stiff. 6. Clicking or locking fingers. A condition known as trigger finger happens when a finger gets stuck in a bent position and then suddenly pops straight. This is caused by inflammation in the tendon sheath, which can result from high blood sugar, damaging the surrounding tissue. Over time, the tendon becomes less flexible and may require treatment like steroid injections, or in some cases even surgery. 7. Shoulder pain and loss of motion. Another musculoskeletal complication of diabetes is adhesive capsulitis, or frozen shoulder. The shoulder capsule becomes inflamed and stiff, restricting range of motion and causing significant pain. Like other joint problems in diabetics, it results from sugar binding to soft tissue and affecting the joint's function. 8. Numbness, tingling, or loss of feeling. In the feet, diabetic neuropathy is one of the most serious complications of poorly managed diabetes. It begins subtly, with tingling or numbness in the toes or feet, and can progress to complete loss of sensation. When you can't feel your feet properly, it's easy to miss injuries or pressure points, which can lead to foot ulcers, infections, and even fractures that go unnoticed. 9. Deformities or swelling in the feet. Unchecked nerve damage combined with poor circulation can cause the structure of your feet to break down. One condition, called Charcot foot, causes the bones in the foot to weaken and shift, eventually creating a deformed, swollen foot with a collapsed arch. In severe cases, injuries that go untreated due to lack of feeling can become infected and require amputation. Diabetes is, in fact, the leading cause of non-traumatic amputations worldwide. 10. Digestive problems, like bloating and nausea. Less well known is diabetes' effect on the digestive system. When the nerves controlling the stomach are damaged, gastroparesis can develop, slowing down digestion and causing symptoms like bloating, early satiety, and unpredictable blood sugar spikes after eating. This can be particularly challenging to manage because meals may not be digested at a regular rate. How to know for sure? Get tested. If any of these signs sound familiar, don't panic, but do act. The most reliable way to check for diabetes is a blood test called hemoglobin A1C, HbA1c. This test provides a picture of your average blood sugar level over the past 2 to 3 months. A result below 5.7% is considered normal. 5.7% to 6.4% signals prediabetes. 6.5% or higher is in the diabetic range. The American Diabetes Association recommends screening starting at age 35 and repeating every 3 years. However, if you have risk factors such as family history, obesity, or high blood pressure, you may need testing sooner or more often. The good news: it's manageable and preventable. The earlier diabetes is detected, the easier it is to manage, and in some cases even reverse through lifestyle changes. Here's what you can do right now. Eat smarter. Focus on fiber-rich, whole foods, and avoid added sugars and ultra-processed snacks. Move more. Combine aerobic exercise, like walking or biking, with resistance training to improve insulin sensitivity. Watch your weight. Even a modest reduction in body fat can lower diabetes risk dramatically. Quit smoking. Nicotine worsens blood sugar regulation and damages blood vessels. Check your feet daily, especially if you already have diabetes or are at risk. Look for cuts, swelling, or color changes. Diabetes doesn't always start with dramatic symptoms. It whispers first. A dark patch on your skin, a finger that won't straighten, or a cut that's slow to heal could be your body waving a red flag. Don't ignore it. Recognizing these outward signs could help you, or someone you love, catch diabetes early and take back control. The path to better health often begins not with a test, but with paying attention. So if something feels off, listen to your body and talk to your doctor.